Today, Secretary of State Mike Pompeo accused China of a cover-up during the early days of the outbreak. It is the latest in a rhetorical pressure campaign on China throughout this crisis. China has pushed back, launching an information war that has included conspiracy theories and highly publicized sales of medical equipment to other countries, including the United States. Nick Schifrin reports on the battle to control the narrative and the blame for COVID-19.
In the European epicenter of the COVID-19 outbreak, the cavalry was Chinese. This is Chinese television, showing Chinese doctors and Chinese medical equipment arriving in Lombardy, in hard-hit northern Italy.
The donations from China are what we urgently need, which can save many lives. I thank the Chinese people. Thank you.
The Chinese government says it's exported more than 3 billion masks, 3 million test kits, including to the Philippines. Nigeria held a press conference to show off its Chinese aid. And Venezuela showcased its Chinese arrival on state TV on March 28. By that time, China was past its peak and was trying to help countries in the middle of their peaks, said one of Chinese state television's top international anchors, Zhou Yue.
It is time to think in the framework of shared human community.
But shared community did not mean free. Italy had to buy Chinese equipment after it had earlier donated supplies to China. Spain's prime minister announced publicly the Chinese tests it received were defective. The UK admitted Chinese tests it received didn't work. And the US called China's mask diplomacy an effort to mask culpability, as Secretary of State Mike Pompeo reiterated today.
China didn't share all of the information it had. Instead, it covered up how dangerous the disease is. It didn't report sustained human-to-human transmission for a month until it was in every province inside of China.
The U.S. accuses China of a pattern of deception beginning in December, when Wuhan Central Hospital doctors realized the pneumonia they'd been treating wasn't normal.
They share the information with their relatives, their friends. They were asked to shut up.
Yanzhan Huang is the Council on Foreign Relations' senior fellow for global health.
In early January already, the local government officials knew that some healthcare workers already got infected. And that was smoking gun evidence suggesting human-to-human transmission.
Dr. Ai Fen was the director of emergency medicine. On December the 30th, she told her medical school classmates she'd been treating a new coronavirus with apparent human-to-human transmission. But the hospital rebuked her. On December 31st, the city government further smothered her alarm, releasing a public notice. The investigation so far has found no obvious person-to-person transmission. And on New Year's Day, the local government ordered early virus samples destroyed and announced that rumors had spread about pneumonia causing adverse social impact. They detained the 8 doctors whom Ai had told, including Dr. Li Wenliang, who would later become the symbol of China's crackdown. The Dr. Ai said she went home terrified and told her husband, if something goes wrong, you can raise our child.
Why did local authorities apparently feel like they weren't supposed to share all of the information that they were gathering?
I think this has something to do with the political structural. So when you have a political structure that was so centralized, that when the top leaders, making all the major decisions, that they essentially deny the local government officials, any incentives to make any initiatives.
Wuhan's mayor, Zhao Xiangwan, admitted he wasn't allowed to speak openly about the outbreak.
As the local government, I can only release the information when I'm authorized to do so.
Local Chinese governments have been accused of hiding fatality figures before. But since President Xi Jinping took power, Beijing's grip on local governments has tightened, says Huang.
I think since 2012, we found that political power has been rapidly centralized to a level that further suppress or stifle the initiatives taken at the local level.
Dr. Li, one of the first medical workers who knew about human-to-human transmission, blew the whistle, warning other doctors about COVID-19. And on February 7th, after treating COVID-19 patients, Dr. Li died. the outpouring of sympathy and anger at authorities who'd silenced him erupted. Authorities acted quickly. Citizen journalists who exposed on social media the slow initial response, including Fang Bin, were arrested. By March the 5th, when a senior official visited Wuhan, residents shouted out of their windows, quote, "Everything is fake." And then came the disinformation. On March the 12th, China's Deputy Foreign Ministry spokesman Zhao Lijian wrote on Twitter, it might be the U.S. Army who brought the epidemic to Wuhan. The suggestion was repeated on Chinese TV, Arabic.
Do you believe a story that the new coronavirus is made by the USA?
After Dr. Li Wenliang's death, there was this strong pressure or demand for meaningful change on the political front. And if you look at the outcome of this disinformation effort, it does actually distracted the domestic attention from making change on the political front.
Could have been stopped pretty easily.
President Trump, who had praised President Xi Jinping and China's response in January, responded to the U.S. Army claim by naming and shaming.
Why do you keep calling this the Chinese virus?
It comes from China. That's why. It comes from China.
1 week later, President Trump declared a ceasefire and spoke to Xi Jinping. That's when China's Ministry of Foreign Affairs and Chinese media replaced disinformation with deflection.
And President Trump and his team were not helpful. Their problem is a lack of serious commitment. And most unfortunately, he failed to communicate the gravity of the problem to the nation when he still had time to brace for impact.
For the Chinese looking to criticize the U.S., there was ample material.
FEMA says we're sending 400 ventilators. Really? What am I going to do with 400 ventilators when I need 30,000? You pick the 26,000 people who are going to die because you only sent 400 ventilators.
Both sides blame each other and portray this moment as a fundamental test of fundamentally different governance.
When I saw Governor Cuomo of New York begging the federal government to step in to get ventilators, I thought, wow, what a difference different systems can make.
What do autocracies do in the face of crisis? They become more aggressive, they deny people their rights, they lie more. In the end, they do enormous harm to the people of their own nation and put the rest of the world at risk as well.
Senior U.S. officials tell PBS NewsHour China is blocking some medical supplies the U.S. bought from leaving China. And China still refuses to share the original virus from early COVID-19 victims, the very victims whom Dr. Ai Fen and Dr. Li Wenliang were trying to save. For the PBS NewsHour, I'm Nick Schifrin.